COVID just won't go away. Latest figures show there have been more than 43,700 cases reported in the last 24 hours, the seventh day in a row that there have been over 40,000. There's been another 223 people who've died, the highest daily number since March, though that may partly be because of delayed reporting from the weekend. So what is going on? Well, these are the case rates by age group, and by far the highest are in children aged between 10 and 19, with more than 1,100 infected in every 100,000. And there's been a sharp upward trend in recent weeks. A long way behind are younger children, with a rate of 574. Then it's people in their 40s, perhaps the parents of those children, but with a much more gentle rise. In other age groups, cases are much lower. So the current wave is still largely confined to children who are unlikely to become seriously ill. Who's being admitted to hospital then? Well, the older you are, the more at risk you are. And that's as true now as it was at the start of the pandemic. Admission rates in the over 85-year-olds are 37 in every 100,000. That's 8 times higher than in people between 45 and 54. So infection rates are high in the young, and hospital admission rates are relatively high in the old. And what draws them together is the vaccine rollout. Just 16% of 12 to 15-year-olds have had their first dose. There's lots of vulnerable children, and the virus is spreading easily. In the elderly, immunity is waning, which is why booster doses are being rolled out. But so far, only 46% of the over 80s have had a booster. So again, lots of people are increasingly vulnerable until they get their immunity topped up. Stepping up the vaccination in the old and the young is the way to stop the surge in infections and short-circuit the rise in pressure on the NHS.